From Flourish DX, this is the Psych, Health and Safety Canada podcast, with workplace mental health becoming a priority for businesses who want to retain staff and prevent burnout. This is the source of information for creating sustainable and psychologically healthy workplaces in Canada.
Well, welcome back to Psych, Health and Safety Canada podcast. And today I'm really thrilled to say hello again to Ruthann Weeks, who's been on a bit of a journey with me this year. We've been talking about motivating the powers that be. We've been talking about inclusivity. And I was just very impressed with Ruthann's journey, what she has to contribute, and I think you're going to agree with me. So I'm going to start with welcoming Ruthann and getting her to tell you a little bit about how she got into the field of psych health and safety. Welcome, Ruthann.
Thank you, Marianne. It's I'm really happy to be here. And like many businesses, mine started, or pivots in the life journey, I should say, mine started from an adversity. I found myself unexpectedly unemployed in 2015, having experienced workplace bullying and being bullied out of my position. I had started a new position. It was sort of the most natural progression in my career path. And I was a middle manager, director. And I had joined a team that had a couple of people retire, and they'd been working together, for decades. So I was a newbie. I made the assumption that because there was not a lot of turnover within that organization, that it was a great place to work. And it didn't take me long to really notice that I did not fit in, that I was really struggling to find my space within that organization. I found out my very first day at work that the executive director who had hired me was retiring. She was also retiring within 3 months. There was a peer director that stayed for the good of the organization. And I'm not being ageist. I'm just letting you know this is not a subconscious bias. She was 70 years old and she was staying for the good of the organization. And what that really meant, or what I experienced that meaning, was that so nothing would change. And I really struggled to fit in. I wasn't consulted on anything to do with my team. This peer director assumed many of the management duties without us ever being told that that's what would be happening. And to this day, I don't know if the executive director in that organization was sick or what was happening, but I rarely saw her. I was there for 3 months and I may have seen her in the office 8 or 10 times. But there was no communication, right? And communication, as we know, is really the crux of, good teamwork and psychological safety. So it was really hard for me. I have ulcerative colitis. And that disease had been dormant for years. And the stress of this situation, me laying in bed trying to ruminate over, situations that had happened, conversations that had happened. What could I have done differently? What can I do differently? That was taking a toll on my mental health. And it showed up in my disease, and that disease flared. And in the morning I'd be driving to work and I'd, be relatively healthy, although you could feel the anxiety build the closer I got. And by the afternoon I was quite sick, but I did my best to hide it, as we do. My team and we got along great. They saw my vision, they supported me, but it was very, very difficult to create change. Some of the things I would say would be misconstrued. I suggested moving some files and got accused of wanting to destroy files by this peer director. So basically what happens is, within that environment at work, if you're not free and safe and encouraged to share and express ideas, you end up retracting into yourself, walking on eggshells, afraid to say anything. You feel very judged. You don't feel like part of the team. And that's really, although I would never have even called it workplace bullying at the time, even though it was the covert behind closed doors stuff, I certainly didn't know anything about psychological safety. And to know that that was I was operating in an environment with very little psychological safety at all for anybody, because everyone else in the office would keep their heads down, and just as these uncomfortable scenes kind of played out. And I think it was the norm for them.
Yeah, it's really interesting because I know some people feel that an environment where there's never conflict is psychologically safe. But what you've just described is an environment where there's no conflict. It doesn't mean it's psychologically safe. But Ruthann, there's many other people and probably many listening who are in that position right now or have been in that position with the benefit of hindsight. What might you have done differently with what you know today?
I would have interviewed them more. I was very careful about finding my new my new position because I was working in a smaller organization that I loved. I'd been there for a number of years. I worked with people I loved, but I describe it as my wings were touching the walls. There was just nowhere for me to grow and nowhere for me to kind of challenge myself. So I was very strategic about finding my next opportunity, and I should have asked about culture. I didn't. It was a very authoritative, rigid culture. And had I known that, I would have known that it wouldn't have been a good fit for me. Although it's interesting, I don't know that they would have described it that way because nobody, is probably going to say that. But yeah, that's exactly what it was. And you're absolutely right. It's that whole, I talk about it as being a thin veneer of niceness over, a culture that's not, like you say, it's not necessarily overtly toxic, but it's not healthy, and people aren't encouraged to bring their whole self. So ask questions, ask about culture, ask about professional development, because I have credentials I need to keep up. And, that should have been something I asked about. Their professional development budget was $500 for the whole organization per year. So I would have known, again, that wasn't going to necessarily foster growth in my professional development and career path. So
that is not a priority for them.
Exactly.
When you say ask a question about organizational culture, do you have any ways that you might ask the question in order to get a response that wouldn't be, oh, our culture is great, everybody gets along?
Yeah, I mean, you can say, how do you deal with conflict here? Because it's not a matter of if we have conflict, there's always conflict that arises, right? When people are working together, there's always interpersonal conflict. There's always different ideas about the ways things are done. There's, different personalities and ethnicities and backgrounds and perspectives, right? Perspective is reality, and reality is perspective and perception. So really, it's just ask about those things. When you have an incident of workplace bullying, how has that been addressed? Because legally, they should have a way to report. They should have a way to investigate every single claim that's, reported, either formally or informally. They should be able to tell you. They should be able to rattle off all those answers very easily. They should be able to tell you, exactly what's in their violence and harassment policy. They should be able to tell you about the leaders. They should be able to tell you about a time that they've, had an experience like that and they've navigated through it. Ask the interviewer how happy they are with their career advancement and career pathing. And if they hesitate, you'll be able to tell quite quickly,
Yeah, you can see it. You can see that flash in their eyes right away. And the way that they respond. But I like that, because I think that if you say, how does your organization deal with conflict? If somebody said to me, well, we don't really have any conflict, that would be a red flag. Absolutely. If they said something like, well, we encourage conflict, we encourage differences of opinion, and we teach people respectful ways to do it, then that would feel to me like it was psychologically safe. So it's very interesting. So thank you for that. That's a great opening and a great sort of nugget for people right off the bat. Now you also talk about, which is, in Ontario here, we actually have a law that says employers must do certain things around mitigating the impact of domestic violence in the workplace. And of course, people in other areas go, what does that have to do with the workplace? But you've done some work in this area. And can you give some advice to employers about why and how to do this?
Yeah, absolutely. And it's the same here in Alberta. And, other provinces also have considerations for that. And the way that interacts with psychological safety is, and I am going to acknowledge that men also experience domestic violence. They do, but 70% of the time it is women. So I'm going to use that kind of language again. It's not a bias, I am aware. So women will not come forward and talk about their abusive relationship at home for a whole lot of reasons. They don't want to be judged as weak or stupid because everybody has a perception about what domestic violence is, but it's a very complex issue. And the worst thing you can say to someone is, why don't you just leave? Because there's a whole lot of reasons why they'll stay. They'll stay to better protect their children. You know, courts routinely grant 50-50 custody now of children, and they feel that they can protect their children better if they're there rather than leaving their children alone with their abusive partner. Often to leave is to choose poverty. Financial abuse is very much a part of domestic abuse, and not allowing their partner to have that financial freedom and financial sovereignty. They'll stay to protect their pets. They'll stay because they really hope that their partner will change. You know, if somebody get punched in the face on a first date, there would not be a second date. Domestic violence is sneaky, and it is about power and control. It's really, although physical abuse is an aspect of it, it's not about that. Intimate partner violence is about power and control. It's about the perpetrator gaining control over their partner, every aspect of their life. One of the first things they do is they isolate them. So they remove them away from their support systems, sometimes away from their families, their friends. They start to be resentful of relationships they have and time they spend with their family and their friends. And basically what they do is they manipulate their partner, and they kind of flip that switch so that they turn into the victim. Oh, you don't spend enough time with me. I must not be important to you. It's very insidious, and it is a psychological game. And because of that, people in the workplace are not going to come forward because, like I said, they don't want to be judged. They're afraid that their employer doesn't have the skills or knowledge to understand what they're going through, let alone help them. And what I'm finding is a lot of the employers aren't doing the work. They're not getting the training that they need. I do a 1 hour on domestic violence that unpacks it really, really well. It talks about what it is, why they stay, why it's important that they do disclose, because there is a real danger in the workplace, especially when there's an elevated risk. Some of the risk escalation factors we've seen through this pandemic, it's that isolation piece, financial strain on the relationship, people being home together, being sequestered more together. You can imagine someone in an abusive relationship with a controlling partner who is explosive, who has now 3 kids at home, homeschooling. They're trying to keep their job and keep the kids quiet and keep the household running. And so basically what happens is, there's a complete lack of psychological safety. That partner, the target partner, is just walking on eggshells, waiting for the next explosive incidents. Domestic violence happens in a cycle, right? So there's the tension building, that's the walking on eggshells stage. And then there's an explosive incident that can include, it can include yelling, screaming, throwing, kicking, punching, stabbing. It can get really violent, and a lot of it can be psychological. And then, of course, after that, there's the honeymoon stage where the abusive partner is saying it'll never happen again. They're buying flowers, dinners, all of these things. And the woman wants to believe it because she's seen that side of her partner at one point. So, and also, again, as we're talking here, just from a diversity and inclusion standpoint, I want to also, there's same-sex couples as well, and different dynamics there. And there's actually a higher rate of domestic abuse within those LGBTQ2S+ communities and Indigenous communities as well. So it's a multifaceted issue. So basically, the best thing the employer can do is educate themselves and do the training for the whole organization so that everybody's getting it. No one's being pointed out, but it will help employees recognize some red flags that they may be seeing, may be seeing abuse in some of their coworkers, and how to address that. The employer will know that. And if the abusive or the person that is being abused knows that the employer has had that training, they're more likely to disclose. They might not disclose when they're in the abusive situation because, they want to keep it private, but they will know when those risk escalation factors rise and they no longer feel safe at work. They may be more likely to disclose, and the employer should have a policy and procedure that they can then implement in that incidence. If they don't have a plan, I've heard of an employer that paid a security guard for 3 weeks to stand beside a woman's desk. And while that did probably make her feel safer, there was a lot of other things that wouldn't have been so expensive and maybe wouldn't have been so intrusive on her privacy to help keep her safe at work as well.
Yeah, I have heard from others who are advocates in this area that for the employer, the manager, the supervisor, that they should put it in their diary so that there is actual dates and times where somebody appears to have been dealing with something, or there's marks on them or whatever, because in the end, that's the evidence that's needed in order to prosecute. But I can tell you, Ruthann, I personally know 2 men who were victims of domestic violence, and it does add an extra layer because, stereotypically, the man should be stronger. And these men were, but they were taught not to hit a woman. And therefore, they just took it. But they took it and it became a habit that they were constantly being pushed around and hit and struck. And I think we do underplay because you say 70% are women, but that's known, right? That's that we know of. And I think it might be a more even that's not ever reported.
Exactly. Yeah. I mean, those numbers, those are just the reported incidents, right? And I absolutely agree. I know the percentage of men experiencing domestic abuse is higher, and there is a stigma. I mean, men shouldn't hit women, right? They should be taught that. Women should be taught not to hit men as well, right? I mean, we don't hit each other. We go through things. We learn how to cope and manage our stressors and to have those interpersonal relationships in healthy ways and set boundaries and all of that. But you're right. I mean, the low reporting, I think, for the incidence of men experiencing domestic abuse is related to that stigma, right? It's related to toxic masculinity. Boys don't cry, boys, suck it up, that kind of thing. Those messages that too many boys get that just really hinders them in having healthy relationships with themselves and with others. And yeah, it can be really hard for them. And the other point around that, bringing males into the conversation, is, perpetrators of abuse have jobs too. So it's really important that coworkers, supervisors, bosses, if they hear, someone on their workforce say, oh, she's really going to get it, or I'm going to go right over there now. And, they should take that seriously and really pay attention to that. There's incidents where male perpetrators will use company vehicles to stalk their partner, that kind of thing, and use company resources and time. So it's a real drain on resources, as you can imagine, in a business.
Yeah. So you're protecting the individuals. In some cases, you're protecting other people in the work environment, but you're also preventing the loss of that employee if they have to leave or, go somewhere else. So there's lots of reasons why employers can do it. Now, you're on your website. It says that you're an advocate for an abuse-free workforce, workplace, and all of this ties in the bullying, the domestic violence. It is a broader leap to psychological health and safety. So can you talk a little bit about when you first heard about psychological health and safety and what drew you to it?
I think it was a meeting I was at with some professionals, and we all had kind of our niche area. And when I got into my formal education is in human resource management, but I worked where I got bullied. I was actually working in the nonprofit sector, and I worked in human service roles for a number of years. And that's where I got really, really good at reading people, helping people with their situations. I'm a certified resource specialist. So they would come to me with, a laundry list of, I just left my abusive partner. I've got my 3 kids in the car and I have no money, or, anything from I don't have enough food to get me until the next delivery from the food bank, that type of thing. So there were people in crisis, and I learned how to help them, to give them dignity in their trouble, and to really give them a plan. I'm not a counselor, but I would give them a plan. So they'd come in with their stress level up here and we'd talk it through, and I'd give them a plan and I'd connect them with resources. Sometimes they need advocacy. Sometimes they would just want follow-up. Sometimes they're good to go on their own. So you really just let them lead. But I learned a lot about letting people, giving people dignity and respect. And so really, I'm very passionate about creating harmony in the workplace, which is my business name and my mission in the world. But it's really, my work marries the human service side of human resource management, because they don't teach about any of this kind of stuff in business school. They don't, I mean, they might be now, but they certainly didn't when I got my education, and that wasn't that long ago. They don't teach about psychological safety. They don't teach about workplace bullying. They don't even teach about sexual harassment or any of that, other than, you can't do it. But there's not really, they don't get into the weeds on what it actually is. And these are really complex issues. So I like to say I know an awful lot about a little bit. I'm a subject matter expert in workplace abuse and all facets of that. And one of the people at that meeting had mentioned that they just got their psychological health and safety advisor training. So I looked into it, and it was such a good fit with what I was doing that I went down that path as well.
Oh, that's great. That's great. Now, one of the things that you talk about, which I find fascinating, is we talk about neurodiverse individuals or atypical. And, more and more we're understanding the value that somebody who maybe is on the autism spectrum, somebody who doesn't think the way the average person does, can contribute something that is so valuable to many work environments. But you have a phrase that really struck me, that think about accommodation instead of inclusion when you're thinking about these folks. And I remember Ruthann years ago, and it was an employer who had somebody with borderline personality disorder. And what they wanted was to make that person a team player. And we talked about the work. Their work was amazing. It was very high quality, very good. But whenever they got into a team setting, there would be conflict. And I said, is it necessary for them to be in that team setting? Or could that be the accommodation? Allow them to do what they do well and don't keep subjecting them. So I'd love to hear your take on accommodation versus inclusion.
Yeah, you know what? It's organizations accommodating is part of inclusion. And the reason I say it that way is, from an HR perspective, we know we need to accommodate any of the protected grounds up to the point of undue hardship, which is a very high benchmark. But the person experiencing the neurodiversity, who is neurodivergent, they don't feel safe. They don't feel psychologically safe coming to their employer and saying, I need this to do my job well, and I need that to do my job well, because they're afraid that it's going to affect their career path. They're afraid that if they even disclose, do you know how many people are probably on the autism spectrum that have no idea that they're even on it? It's a big number. These are affecting millions and millions of people in our workforce. 1 in 7 is neurodivergent. And, that includes autism, ADHD, dyslexia, all kinds of anxiety disorders. And it's a broad spectrum. of people. And really, you know, I just say normal is just a setting on the dryer, and we really need to change the way we people, right? Especially in those organizations that require innovative thinking and people being able to really be very, very good at what they do. It doesn't necessarily mean that they're going to have that high level of social intelligence. But I always say talk to people, ask them what they need, because there's no one that is alike. Even, you know, within the neurodiverse community, obviously, there's no label we can put on people. There's no list of character traits that we can say everybody has. So really, I always say talk to people. They will tell you what they need. They may not disclose that they're neurodivergent. They may not even know, but they know what they need. People know what they need to do their job. There are people that are on the spectrum that are very, very uncomfortable face to face. They prefer to be on a Zoom call like this. It doesn't mean necessarily that they can't do teamwork either. I've talked to some neurodivergent folks that they can do teamwork and they can contribute to the team, but they prefer to process it and, you know, offer their feedback in writing. It's just the way they work. You know, there's a lot of people on the spectrum who can't even handle sitting in a white painted room. They see colors differently. They hear sounds differently. They experience things differently. And, you know, as a neurotypical, I've been digging into this from an HR perspective. It's really, really important that we get this right, even related to workplace abuse, because you can imagine, you know, what I'm hearing is that neurodivergent folks, they don't necessarily recognize when they're raising their voice. They can be yelling and have no awareness of it. They don't recognize necessarily that what they're saying is inappropriate. But I'm also hearing that they don't want to hurt people. So what I recommend is just get really, really curious. You know, instead of being offended, just pause a beat and say, this is what you said. Is that what you meant? And repeating it back to them will let them know what your perception is, first of all, of what was said, and give them an opportunity to, you know, either agree with that and take that a step further, or, you know, say, no, that's not what I meant at all. This is what I meant. And it's really about opening that dialogue, pausing before being offended, pause for that response instead of a reaction. Like, you know, when we react, we're reenacting things that we've either done in the past or that we've been taught. And, you know, it's really taking that pause, formulating your response, and moving forward. And it takes a high level of emotional intelligence to be able to do that. And it really, you know what, you have to check your ego at the door too, because we have to make room for people to be themselves. And the employers that get this stuff right are going to be the talent takers in the 21st century, because we're in a global skills shortage, because, you know, by 2025, 75% of the global workforce will be comprised of millennials, and they are a different animal. They have different values, different things that are important to them. They want to do life and work differently. Gen Z coming along behind them are the same way. And so it's really interesting with the four different generations in the workforce right now. And it's a lot on HR, and it's a lot to juggle, and it's a lot to, get those interpersonal relationships right. So it's really important for employers to be resourcing that and recognizing that as well.
Mm-hmm. I really think we're going to, and I've said this all along because I gave birth to two millennials, is that even if I did nothing, they would not tolerate the things that I tolerated in the workplace, that they expect to be treated, you know, with dignity. And if that's entitlement, which some people like to slap on them, then I think they're entitled to dignity. I think they're entitled to be psychologically safe. I think they're entitled to have a life outside of work and to have healthy boundaries. So if that's entitled, I also think they're smarter than I am.
Yeah.
And I think a lot of them too looked at their parents and said, yeah, I'm not doing that. Like, I'm not going to be exhausted and overwhelmed with work all the time. I'm going to have balance. I'm going to prioritize other things in life. So, yeah.
It's important. And, it's not necessarily that they're smarter than us. I think it's just that they know what they want more. For us, I'm an echo. I don't know about you. I'm a Gen X. So I am sort of the echo of the boom. By the time I got to the workforce, it was not a employees market, let's just say. It was an employer's market. And so people were just happy to find a job. But you know what? I think there's still a lot of that, Marianne. I think there's so many people just doing jobs. I saw a Facebook post this morning from a friend of mine. She was posting 3 years, 42 days and whatever hours until her retirement. I thought, how sad, to be just that, it felt like she was white knuckling it until she got to that retirement. But what are the next 3 years of her life going to look like if she's just so miserable,
Yeah.
And I think there's a lot of people doing that. There's a lot of people that are afraid to make a change. And I think, millennials know, I believe, that they do hold that balance of power. They can make those demands and those requests that are healthy. You're right. It's not entitlement. Just, by being a living, breathing human being, we have right to dignity and respect.
Yeah.
And it's really important. And I'm really happy that them and the Gen Zs are really standing up for themselves in that regard.
Yeah. I wish that everybody could enjoy their work the way that I do. I really wish that was true. And I think about my mom. She went from somebody who was going up the ranks in banking, and she quit, and she became a janitor in a school. Mm-hmm. And I mean, when I was younger, that's what she did. Now I think about it and understand the big shift that she made. And she loved the work in the school so much that she actually went 5 years past when she could have retired, because she didn't want to give it up. She loved being there. She loved contributing. So I think, it's if people could learn to love the work they're in or find the work they love, I think it could revolutionize their lives more than anything. So before we run out of time, I also want you to talk about the Pciho model and how you think that can be used in workplaces to help improve psychological health and safety.
Yeah, thank you for asking about that, Mary. And it's something that I incorporated in my diversity, equity, and inclusion belonging training. And it was created by Joshua Rich and Roddy Galbraith. And it's a framework for identifying where individuals within the workplace are with relation to diversity, inclusion, and just change, basically. So it's PCIHO, pioneer, champion, influencer, hesitator, and obstructor. Okay. So the pioneer is generally the person that brings, a consultant in or spearheads the initiative to be more diverse or, to bring more psychological safety or whatever that might look like. The champion is all for it. They think it's a great idea. It's something that they're interested in either socially or professionally, or they, that's something that is important to them as well. The influencers want to support the champions, and they want to just really help bring others along and sort of, we talk about lighting each other's candles or with the same flame, and just help that to spread. And ideally, we want everyone within the organization to be either an influence, a champion, or that pioneer. And the H is a hesitator. So the hesitators just aren't sure if this is a good idea or not. They don't want to stick their neck out. They don't want to step on any toes. They don't want to really put themselves out there in any way that is at all risky. And we know that psychological safety is about taking that into personal risk, right? And then there's the obstructor. The obstructor's got their arms crossed. That won't work. We've done that before. This is not the way we do things. And so our message to that obstructor is, if you can't be for it, can you at least not be against it? And really what we do is we don't go into organizations and put labels on people within this framework. We explain the framework to them. We get into the nitty gritty about values and what is important to them and what that looks like and how this plays out in the workplace. And we want them to self-identify where they are within that structure. And when they have that awareness and bring that awareness to them, then the first step of creating any change is building that awareness, right? So once we bring that awareness to them, we can hopefully bring them up to the PCI level of creating that change and making the workplace better.
And would you teach that awareness training before the change is introduced or after the change is introduced? Because is it in relation to a specific thing versus generally?
Well, that depends. I always think it's important you don't start with the survey. You don't start with the survey. You start with a conversation. You talk to your employees and you tell them, this is where we're headed. This is what we're interested in. What do you think about that? How do you think that will work? And, not everybody is going to participate and even give you that feedback, but you can help and quite quickly identify who within the organization is going to be a team player in that regard. And then you help them craft the metrics and the surveys that you want to do. And from there, it's building that awareness, I think is building that awareness. I work on a results-based change model. You identify those KPIs and they can be different for each organization. We have different objectives. Some that are in tech, for example, need innovation. So they need to really be able to pivot and handle a lot of change and be willing to fail forward and that kind of thing. And there's other organizations that are more traditional, maybe that, you mentioned your mom in finance. Well, finance is a very traditional sort of formal field that is wrought with a lot of unhealthy dynamics as far as power and control go. So I can see why she wanted out of that. And she's not the first one I've heard that's bailed from the finance sector, especially women, because there's still a lot of disparity there. So, it's a complex issue, but really we want to just have people self-identify and use that to help bring them along and just to really, it's always a tailored approach. I guess that's the best answer, Marianne. There's no one size fits all.
No, and I think that's, even with the national standard on psychological health and safety, I think people wanted to just tick off boxes and say, there, we did it. And it's not that. The standard itself is a framework, it's guidelines so that you can think about, have we looked at all the different facets? But it's talk to your employees, identify their needs, and then create a plan to address them. And then it's going to be different with not just with every organization, but with every team within the organization.
Yeah, true.
Yeah.
True. Yeah.
So it's interesting as we move along with updating the standard and looking at what we've learned so far in the past 10 years and where we're going to go from here. It's going to be fascinating. Is there anything else, Ruthann, related to any facet of psychological health and safety that you'd like to leave the listeners with on this podcast?
You know what? The thing that I think is most important about psych health and safety is it allows people to be themselves at work. Whether they're quirky, and we're all quirky, we all have our quirks, we all have our weird things that we do. And I think, that's okay to be able to kind of bring that into who you are, to show up as yourself in the workplace and contribute fully in a way that is rewarding and is also, bringing your best to the table and being set up for that success. I mean, when we look at the 13 psychosocial factors, they're not complicated things. They're simple things. I say it's simple, but it's not always easy, right? Because there's egos that need to change and there's leadership that needs to change. And often I don't work with any organizations that want to just tick the box, because I mean, that's my reputation as well. If I work with an organization and there's no change, I want to work with organizations that have that transformational willingness, that really do want to bring their best out in their people and not just say they want to, but really do it. And sometimes that means that they need to make those hard, right decisions in transitioning out of toxic influence. We want to set people up for success. We want to bring them along. But our job is not to make nasty people nice. Our job is to protect people in the workplace within the legal framework that is there to protect them from abuse and harm at work. And when we get it right, and we get that level of safety and support, the ripple effect is amazing. The individual excels and does wonderful. The organization excels and does wonderful and has a competitive advantage. The ripple effect out to their family. If someone has a great day at work, they're not going to go home and yell at their kids or kick their dog or whatever that might look like, hopefully. And then, to society at large. So it's win-win-win-win when we get it right, except for to those that are those obstructors and they just can't see their way to create or participate in any change at all.
And then what's your advice? I always hear the conversation, bring your whole self to work, be able to be your unique self. And you said our job isn't to make nasty people nice, but what if nasty, angry, disgruntled is who I am? Am I bringing that whole self to work?
Good point, Marianne. Yeah. And, that's it. That's kind of where psychological health and safety can be used against people, right? They say, well, I'm just expressing my thoughts and opinions and ideas the way everybody else is too. And I have a right to do that. Really, the litmus test on that is what you're saying, attacking anyone? Is it hurtful? Is it, is it personal? We want to really help. Hurt people, right? There's things that made these people that way, and we want to reach them and we want to help them change and we want to support them. But we can't do it at the detriment of the people around them.
Mm-hmm. And I think that's the piece that in many organizations are missing. They'll have the workshop, they'll talk about teamwork, they'll talk about mental health, but there's nothing that actually holds people accountable for behaviors that do no harm. And it, as you and I have talked about before, if we don't embed that in the way we interact, in the way we do meetings, in the way we handle conflict or differences of opinion, then you'll never have a psychologically safe workplace. You'll just have people with lots of information, but it's not changing behaviors.
Yeah. How often do you go to a training and you're really fired up, or a conference and you're really fired up when you come out of there, and then you put the binder on the shelf and it just kind of sits there, right? We want to do work together. We want to learn. We want to create our organizational culture with intention, because if we don't create it with intention, it creates itself by default, and that can be really risky.
Yeah, for sure. So I want to ask you one more question, and that is, how would you describe psychological health and safety to somebody who has no idea what it is and you just want to paint a picture for them? How would you describe that?
Psychological health and safety is about feeling free and encouraged to take interpersonal risk in the workplace, expressing thoughts, opinions, ideas, in reporting mistakes, in reporting those near misses for the simple purpose of learning from them. There's no blame, there's no shame, there's no reprisal. You'll know you have psychological safety in place when mistakes are reported when no one's watching, right? For the simple purpose of improving those efficiencies and learning to do things better, and just to supporting each other and supporting the environment. And it's really that level of safety and interpersonal risk-taking and candor in healthy ways. Yeah, that's kind of it in a nutshell. It always comes back to that communication piece for me.
Mm-hmm. Yeah, it really, that's what it boils down to. So Ruthann, thank you so much for your time today, for all the nuggets of wisdom that you shared with us. How could people get in touch with you if they wanted to talk to you more about the work that you're doing?
Yeah, my website is harmonyintheworkplace.com. I'm here in Alberta, phone number 780-460-1019. You can reach out to me on LinkedIn, Ruthann Weeks. I'm assuming you're going to have my proper spelling of my name somewhere, Marianne. And yeah, I'd love to connect on LinkedIn and follow each other that way. And really, feel free to reach out anytime. Our weeks at harmonytraining.ca.
That's great, Ruthann. So thank you to you. Thank you to Flourish DX for supporting this podcast. And anybody who's interested can find us on LinkedIn, Psych Health and Safety Canada. And when this podcast comes out, it will be there and featured as well as the little nuggets of wisdom that you shared online. So thanks so much. Have a great day.
My pleasure. Thank you.
You've been listening to the Psych Health and Safety Canada podcast. To stay up to date with the best content on workplace mental health in North America, subscribe wherever you listen to podcasts and join the Flourish DX community at www.flourishdx.com.